Okay, I think we should get started. Hi, everybody. This is Shannon Woodisell, the Executive Director at ECFC. We're really happy to have you join us today for what we've set up as weekly sharing and update calls on COVID-19. And what we're planning to do, although we will obviously pivot as things warrant, is we'll have a briefing 1 week and then just some peer sharing the following week. We might, tap a couple people to talk about a peer sharing topic. We might ask one of you to talk about something you're doing or to bring your questions in advance or something. But we're going to try to alternate briefings with peer sharing and also partner with our friends at the Alliance for Early Success so that when we're doing briefings, sometimes maybe we'll just do them together because they're also setting up briefings for state advocates. So today this was probably the most obvious thing to plan in terms of what we needed to talk about today. And that was all of the action that has happened in Congress over the past couple of weeks around COVID-19. And we're really pleased to have with us a couple of experts to talk to us about what's going on in Congress. And I'll just say, as we set this up, one of the reasons that we think this is especially important to talk about is because a few of the principles that we've had that are on our website is one, that we recognize that advocacy investments and organizing investments are really key in this moment, because as I think you will hear from our speakers, what the public coffers can do for families and for providers is going to just be on a scale much, much bigger than private philanthropy would be able to do as far as direct assistance. And so that's why we've been emphasizing, the importance of those advocacy investments, even as, and it's so hard to balance it out, the both and, because we know that like direct needs of families and of people who are caring for families are also very much pressing at this time. So that's one. And then the other thing is, one of our operating theories here that I think you'll hear about from both Sarah and Danielle is that one way that funders can help leverage the public investment is by spending private money to help ensure outreach and enrollment into the new public programs for the kids and families and providers and caregivers that we care about. And so I think that there are some opportunities there that on the one hand are just emerging. On the other hand, some of these new programs are kind of first come, first serve. So you'll hear about that. So on the one hand, these are just emerging opportunities, and on the other hand, we don't have a ton of time to ramp up on it. So we're really happy today to be joined by Sarah Rittling, the Executive Director of the First 5 Years Fund, who's going to talk to us about what's happened in Congress over the past couple of weeks, and also how she and her colleagues who work on national advocacy are thinking about what's happened, where we are in the arc and the trajectory of what needs to happen, and what a framework is for thinking about how we secure these gains, be sure people can use them, figure out what we need next, and tell the story of what's happened. She's got a framework she can share with us. And then we'll hear from Danielle Ewan, who's a principal at Education Council, and Danielle will talk about how this relates to what's happening in states, because Danielle works with the Alliance for Early Success on the links between federal and state policy, and so she'll be in a good position to talk to us about that, because we're very cognizant that we have many, many state and local funders who are joining us today. So without further ado, Sarah, I think we'll just turn it over to you. And I'll, one last word, if you want to chat questions in the chat box, we won't necessarily interrupt Sarah while she's talking, but what we can do is we can either then tee you up to unmute yourself and ask your question at the end, or we can ask it if you're feeling shy. But that way you don't have to wait. You don't have to wait until the end. You can put your question right in the chat box so we capture it. All right, Sarah, thanks so much. Please tell us what's happened.
Oh, sure. And thank you for inviting me to be on and talk a little bit about what has happened at the federal level and what could be happening at the federal level, as well as what we think should happen at the federal level. So there's a lot there. I think what I want to start with is the kind of where we were and where we were and start, and then lead up to kind of where we are. And one of I think the grounding principle in some of this is that Congress has done have had three different legislative actions. There was phases, phase 1, phase 2, and phase 3. Phase 3, the CARES Act, which we have all, I don't know, somebody.
I think what we should do is we should mute everybody if they're not already muted. Okay.
Okay.
I'm going to mute everybody, Sarah, and then I want you to unmute yourself, okay?
Okay. Thank you. So the CARES Act, which was the last piece of legislation that passed, I think it's important to note that was passed and signed into law less than a week ago. And it covered, it was a relief package that covered everything from the needs of hospitals to the needs of industry to the needs of families. And so when we were thinking about the very real crisis that we're all living with, and the fact that childcare was particularly one issue that was coming up time and time again as being a desperate need, both in the sense that we were looking at the fact that there was an industry that was certainly going to go under and would not be there when everybody returns to work, as well as the very real needs of families right now in the midst of the crisis who are looking for care, as well as providers. And what Congress ended up doing is addressing those issues in a number of ways, not in one way in particular. So there are things, and we have plenty of things, plenty of materials we can share to give you the details of this, but there's a couple of key areas that they addressed. There was a $3.5 billion increase to the Child Care and Development Block Grant, which will go out by formula to states. And that is a very flexible pot of money, even though it is going through CCDBG, to go to the needs in states right now. So very, very flexible and very welcome, I'm sure. The other are some of the small business provisions that we're hearing about now in a lot of different venues, not just in childcare, but it's coming up certainly for all of business. And this is one area where Congress certainly was pointing in the direction of childcare as well. And then there are other things that are going to help and assist families, which we've also read a lot about over the course of the past couple of days through the immediate tax rebates and other things. I think there's a longer list. Obviously, Head Start receives some money as well, and other things. But I think one of the biggest points that we that comes out of that package is that there's a very real understanding that it is not enough, particularly for childcare, and that this crisis has unearthed a lot of, or surfaced a lot of realities about the system, or the lack of a system, and how we're responding. And so even though the bill or the law is now not even a week old, we have very quickly stepped into what next mode, working with many of our colleagues and other organizations at the national level to do a number of things. One is to make sure that this information and what was included in the bill across the entirety of the bill, which is huge, is disseminated in a way that that makes sense and that people can take advantage of, whether it's the CCDBG dollars or the small business provisions or what have you, making sure that there's awareness of that. Two is really collecting real-time data and stories and information about how those provisions did or didn't work and how much more need there is out there. It will be very difficult for us to go to Congress when they come back to do the phase 4, which we're already talking about right now, if we don't have clear understanding about why what was included in the CARES Act did or didn't work, or what or was not enough. We know it's not enough. What else? What did we learn that we can direct towards the next set of solutions and funding that's going to come out of Congress at some point in time. And I think that the third piece, obviously, is how we're capturing that, but relaying it back. At First 5 Years Fund, our audience is very much Capitol Hill and Congress, and so the sales job, frankly, of making sure that we're doing this in a strategic, bipartisan, and actionable way so that something happens down the pike is where we're really focused as well. And working across and in collaboration with our partners in the field as well as at the national level in doing this. We heard loud and clear from Congress that because there was a unified coordinated effort around the needs of childcare, it made it a lot easier for those who are writing the bill to take action and include things and have an understanding and awareness around it. And that's a really critical advocacy tool, which all of you know, going forward. And really, when you think about it in the context of the totality of what a next package is going to look at, are we looking at relief? Or are we looking at recovery, and how does childcare and early childhood education fit within that? And we all know it does, but it will be competing against things like, you know, you name it, the economy, everything we're seeing and hearing about, the unemployment rates. All of those things are going to be things that Congress has to be dealing with, as well as the really dark days for states in terms of their own budgets and what Congress is going to have to do there as well. So there's a lot to grapple with. And I think, you know, we all are well aware of and living in this unprecedented time. But I think in terms of having a playbook for how we can try to move forward, particularly on the advocacy front, feeling that we need to do that, and we know what we need to do. And so trying to do that swiftly in campaign style now, recognizing that we don't know yet what the next 1, 2, 3 things look like. And I think that's in the short term. The longer term vision is clearly that what I kind of started with, which is that, you know, what does this whole thing look like? And how does the federal government support it? And what are we learning from this crisis that's going to inform future policy decisions when this is over? So a lot of work to do on all of our parts. And I want to say I just, you know, really appreciate everything that's happening at the state and local level. I am just stunned, and not stunned. I marvel at the swiftness of how things have happened and information sharing and what people are doing to make things happen on the ground, and being able to relay those stories inside the Beltway and with Congress has been instrumental. So thank you for all of that. And thank you, Shannon, and everyone for letting me be on. I'm happy to answer any questions as well as follow up with any responses that I don't have.
Thanks, Sarah. So I think Danielle's just joined us, but I think we have a few minutes. If folks have questions for Sarah about what's happened or, you know, what we expect to happen next, why don't you go ahead and either type them in the chat box, or like Rena said, if you go way down to the bottom of the participant list, there should be a raise hand icon. And we want you to be able to ask your own questions. So when you chat them, we'll suggest you unmute yourself. But
and I will say we are daily updating our website with resources and tools about what is included. So we do have things posted now, but they'll be coming out fairly regularly as well. So.
And I would say the other thing is that after this is over, we are going to send out a suite of things, including the things that you guys have put out, Sarah, and the Bipartisan Policy Center and Committee for Economic Development document, and some other documents that we think people will find helpful. So, okay, Eva Roberts. Oh, go ahead.
Hi, Eva. I think that's a great question. I've heard as soon as humanly possible, but I know a lot of people are digging into that today. It has to go through the process, and I know a lot of things are being expedited, but it's only been 4 business days.
And one of the things that we'll send out is we'll send out the estimates from the Center on Law and Social Policy about how much each state is expected to get. They have, and so that's one of the things we're going to send out. The links were very long. We were going to put them on a slide, but it would have been impractical. Easier to send you all an email that has the link right in there that you can click on. So that's in the suite of things we're going to send out. All right, a question from Eddie Gale in Vermont.
Shannon.
Hi, Eddie.
And Sarah and Danielle, I just wanted to remind you that we have a number of people that are on the phone only. So if you're reading out of the chat box, if you could repeat the question before you answer it.
Oh, okay. Eddie Gale, how has the federal response to early childhood compared to what you might have expected? Was it a hard push? Did Congress immediately get it? You know, I think that there's been a lot of work over the course of many years with Congress in particular to raise awareness around early childhood education, and do so in a almost painfully bipartisan way. We clearly have a bias for that at the First 5 Years Fund, as that was our starting mission. But we a lot of work over many years to raise awareness levels around the realities of early childhood education across, regardless of how your entry point is with them, has been remarkable up until this point. We've seen a lot of good things come out of Congress, a lot of engagement across both sides of the aisle, both sides of the Capitol. So not your typical members who are writing, appropriations bills or who have jurisdiction over CCDBG or Head Start. It's been pretty broad. I would argue that that all of that work was really helpful, because once you were able to go in and talk to members by phone, and offices, they already understood, and there was an awareness level there that made it a lot easier. I think that it was well understood. There was a clear understanding about not just the fact that there were families who needed care now, but that there was an industry that needed to be sustained through the crisis into the recovery. They were living it and seeing it happen in their own states and districts as well. So I think they immediately got it. I think we did well, but there's a lot of work to do, and we know it's not enough. And so really, they have our ears, and we've already started fielding questions about where this money is going, where the money's gone, and it hasn't even been out the door yet. So there's a lot of room there.
So we have Elizabeth. I'm just going to unmute you so that we have different people's voices on the phone. So it's lagging though. I'm trying to unmute you, and there. Okay, you're good. So why don't you ask your question, Elizabeth? Yep.
Hey, hi, Sarah. You guys do such good communications work. It just seems like when I think that every small business in this country could apply for up to $100,000 loan, and you look at that amount of money that's going into all of this, how can we, once we come out of this, turn this into an opportunity to say, we can clearly afford to pay for childcare? How do we just make it so after this?
Yeah. No, I couldn't agree more. And what I'm hopeful for right now is that we're building that apparatus and starting to launch some of that communication around that, so that it's easier to do more directly when it's over, which is baked into this kind of 4-part effort that I think we need to be activating now around bringing in the information. I don't think we're seeing nearly enough national press on what's happening with the industry, so we're focused really on that as well. I know you're probably seeing it locally, working with the Alliance and others to get some more media attention from their advocates that they work directly with. So I think there's a lot of room here, and I wouldn't say room, I think there's a lot of need there still on the communications front in service to exactly what you said, that at the end, God willing, we're there soon, we're able to really tackle what there is. And I would argue that part of that is are the elections. I mean, there's a lot of questions around that, but the fact is, when we were headed into this, childcare was really a significant part of the conversation. It was part of the conversation in this White House before this, and certainly if campaigns across the board, not just presidential campaigns, aren't talking about this and making a priority for the new administration or a new Congress, then we've lost a huge opportunity, not to exploit the current situation, but we're clearly seeing a need.
So Carol O'Donnell in Connecticut, I am unmuting you. There is a slight, maybe try to do it for yourself, because it's quicker if you do it, I think.
Oh,
there you go. You're unmuted. Okay.
Thank you, Sarah, and for all of your leadership on this. I guess the question I had was, what was the basis for the $50 billion ask? And we know we got far less than that. And what was that based on? And do you see that as the focus for going forward in terms of the next package?
So that's a great question. I think, there were multiple asks. 50 billion was just one of them. There were a group of House members who were asking for 20 billion. If you piece together the CCDBG ask with some of the small business provisions, it starts to add up. Our friends at the Bipartisan Policy Center and CED and others did some back of napkin calculations. There's a lot of different numbers out there. The $50 billion, I mean, I think there's, depending on who you talk to, different makeup of that number. I think it was a great advocacy tool. It was a great push to have it out there. It definitely got us some more money at the last minute. We went from $3 billion in the Senate to $4 billion in the House and ended up with $3.5 billion. That's not insignificant, and that's kind of how it works. And so going forward, it's really up to all of us, I would say, to make sure that when we're putting a number out there, there's, and we just had a conversation today with the Senate offices who put that out there, the justification behind it, how it's going to be spent. Is it one $50 billion ask? Is it $50 billion across multiple programs? Is it $50 billion in a new program? This is where we are in this conversation of moving from this bill to what is the next thing. And so, I think we're just going to have to see, and we're going to have to get really smart on what the need is and how to do it.
So Sarah, I'm going to take moderator's privilege and ask a question that I think will also probably tee up Danielle a little bit, because I think it's something she's been thinking about a lot that we haven't talked about. So I'm going to ask it, and then you can respond, and then we'll ask Danielle to present. So I think we've primarily focused so far on the CCDBG and Head Start funding. I got to be honest, I think my brain has even been neglecting that a little bit and thinking much more about the small business, the SBA loans, and the unemployment, and thinking about okay, if part of what we've got to do, because we know the childcare money will flow to the childcare providers, right? I mean, it's how quickly and how effectively and all that's important, but we know that money is going to get to childcare in some form or fashion. But these other things could really sustain our childcare industry if we do certain things quickly to ensure they can take advantage, I think. But I also know that we don't always know yet about, if you don't, somebody yesterday said, well, one of my funders said, we're learning our folks don't even have LLCs. So how's that going to affect their ability to apply? So I guess that's my question is, how are you thinking about the unemployment insurance, the pandemic unemployment insurance, the SBA loans? And it kind of links to what you were just talking about, because if that ends up being a lot of the money that we utilize in childcare, it doesn't really fit into the childcare messaging in the same way? Like, how does that all get aggregated up as we think about what we're trying to envision for the future?
Yeah, that's excellent. And it's right. So I mean, there is a difference in my mind, right now. How do we take all of these various provisions included in this, you know, multi-trillion-dollar package and piece them together to have them make sense, right? How do you take the unemployment insurance and you interconnect it with the loans, and you interconnect it with the child care dollars, and whatever it is, like, put them in together. Like, you know, you got to stew, and then we've done what we've done for years and years and years and pieced it all together, and we have what we have. Great. But that is not where we want to be, right? We want to take that and make the point that Elizabeth was saying, is like, this is not how you run a system. If you look at Head Start, if you look at K-12, if you look at higher ed right now, they're not having issues like this. They're not, because they have an actual, like, something to piece them together and respond. And we don't. And so if you take this piecemeal approach, which was what had to happen because of the way that the package was put together and the ultimate goals of what they were trying to do in Congress around it, and then take that experience, lesson learned, repackage it, and ship it back to them with what we really think we need. I mean, I think that's our job as advocates, and smart people who actually do work, which I don't, you all do, to make it look like something that, if God forbid anything like this happens again, we're not in this. I mean, it's almost like not reimagining the system, but because there is none, but like, what should it look like so that we're really addressing the needs of families, providers, and industry, frankly, when we're in a recovery? Because I think business is a huge voice in this.
Thanks. So Danielle, I think that would be possibly a good time to transition to you. So I know you got on just a minute late because you were briefing another group of people on another call. So we appreciate, I'm trying to unmute you, but I think it's more efficient if you do it yourself, because when I do it, there's a lag. Oh, we can't hear you. So while you're doing, so before you got on, one of the things I said, which I loved your thoughts on, because I know that you're passionate about it, you contacted me about it too, is what are you thinking about how this fits together from the national to the state? And then, like, what would you advise our funders, especially our state and local funders, around the best way to invest in a way that's going to leverage the federal? So take it away. Thank you for joining us.
Sure. Can you hear me now, Shannon?
Yes.
Great.
I can hear you.
So I'm super excited to be here. I'm going to probably raise more questions than I am answers. I'm going to say lots of things, hopefully in the allotted time, so I'll try to make sure I don't talk like an auctioneer, like you all are used to me doing. And I'm going to draw on information from lots of different sources. So the Alliance has been supporting me in doing this work and has also been gathering a lot of information. The Ounce has been doing this, and we're working closely with them. Lots of other people are doing this work as well. And so I say that both to show how grateful I am for the support from all those people, but also because we're all trying to get our arms around this really big thing that happened in the last 2 weeks in terms of federal legislation and in terms of a month in terms of the virus, and really trying to understand how it all fits together. And the answer to that is that there are still many, many unknowns about all of it. There's unknowns about what guidance will say from federal legislation, from a wide variety of agencies that many of us are not used to dealing with. I've been reading IRS bulletins this morning, and they are not fun. But our community is not used to looking at the Treasury and IRS and OMB to understand what we need to know about how to actually access funding. So there will be many unknowns about what that guidance says and how we can act, and there will be different interpretations. And so it is too soon to say whether something is allowable or isn't. And what I've been saying to people is we have to stop accepting no as a community and work about how to get to yes. And that goes to Sarah's comments about the longer term as well as the short term. The best example I've seen today in the last 24 hours, many of you may have seen that yesterday the Treasury Department put out rules about how folks were going to get their rebate, the $1,200 rebate. They said yesterday early that Social Security recipients would have to file tax returns, and then by the end of the day, with some pressure, they had rescinded that and said, oh no, it's okay. There's still some folks that have to do it. So that's an example of how in flux this all is, and how important raising our voices is in this process and making sure that we're being heard. But really, if I say nothing else, it's about not accepting no, and not accepting that our folks, our providers, our families, our parents can't benefit from different parts of the laws. The other thing I want to point out, and I think this is a real role for philanthropy and other stakeholders, is that there is tremendous flexibility just within the childcare part of the CARES Act. We already managed a law that had tremendous flexibility, and CARES puts out even more flexibility and essentially allows us to serve families however they need to be served. Yes, the Office of Child Care is going to put out guidance probably today and augment guidance that's already in the field. But the truth of the matter is that states can be doing all kinds of things to support families and providers. They can pay for enrollment over attendance, even if providers are closed. They can provide grants to maintain supply. They can pay higher rates for emergency care to compensate providers for the risks they're taking. There are lots and lots of things they can do. And it's important to know that they can do that without actually having to ask. They don't have to file amendments. They don't have to do it before an amendment is approved. And so really thinking about how we can encourage people to use the flexibility that they have right now is really important. And I think that's a role that you all can play immediately. We also want to think about whether we are extending that same flexibility to other programs and encouraging our state leaders to work at the state level to provide comprehensive, coordinated approaches to different pieces of the social safety net. So as we're making sure that we are funding slots, even if kids are staying home because their schools are closed or their programs are closed or their parents can't go to work, we need to really be thinking about how TANF is interacting with that. Are we making sure that we have eligibility policies in place that are not pushing families off of different programs, whether it's SNAP or Medicaid or other things, as we're making sure that they're getting the support they need? These are all roles that you all can play and things that are coming up at the state level. One of the other core roles that we see the need for is to play a liaison role for providers and families. There is, as Sarah alluded to, there are a lot of different places where our community interacts with the rest of the law. So on the unemployment insurance, on a set of things that are all about making sure that businesses can stay whole. I have a whole list. There's the payroll tax deferral. There's the employee retention credit. There's the paycheck protection program. There's the economic injury disaster loans. We can go into what each of those are, but the important thing is that for each of those, there's an application process. For each of those, there's something that needs to be known. And our community, which is made up of entrepreneurs who often don't have a strong business background, who may never have gotten a significant loan in their life, who may not really be doing very complex bookkeeping, that we really need to provide technical assistance in easy, bite-sized ways to those folks so that they can understand how to apply for the things for which they are eligible and to get access to those funds. We are most concerned about the small business loan program. Estimates in the country are that there is no way that the amount of money that is needed is on the table right now. And the program is first come, first served. So really making sure that providers have what they need to access those loans to get in front of those financial institutions and make their applications as soon as possible. We need funding for those liaisons to communicate with folks. We need funding for R&Rs to be the place that providers trust, or for United Way and others to really be conveying that information in a meaningful way that is timely and immediate. The other thing that I wanted to tell you is that there's so much coming towards our field right now. Providers are being told to stay open one day, to close the next. They're being told they're eligible for some pieces of the CARES Act, but not for others. They're being told, oh, do this, but you can't do that, or they don't work together, or stop because you might do something that will hurt you in the long run. They are being asked to become experts on things like leave policy, on unemployment insurance, on long-term fiscal planning. And in a field that is built on the backs of low-income women, largely women of color, we are once again asking them to sacrifice their hours, their physical health, their emotional health, to make sure that the rest of the community can do what it needs to do. And there needs to be some recognition of that, whether it's in incentive pay or whether it's in really looking at the kinds of policies that states are putting in place and making sure that we are putting the needs of providers at the front of some of those lists. An example of that is we've seen a number of states that in setting up emergency childcare or setting up emergency childcare rules have waived licensing and regulation around group size and suspended other licensing requirements, which in the short and the long term are not good for kids and families. It's also important to remember as we're thinking about this, that state policy staff are in the same boat of having so much coming towards them. Most of our childcare administrators have managed a program for years, but have not had to create one. They were given something, and then they lived through a recession. And during that recession, they were told time and time again to serve as few families as possible, to not spend money, to make sure that they were saving money or not spending in a way that was creative. And they are also hearing from their fiscal offices within their own states that there is a serious recession on the horizon and that state coffers are not going to be able to support some of the things they've been doing. All of these things contribute to an environment where state administrators may not have the ability or may not feel free to be creative in how they're using the money that is available. And we really need to help give them ideas, give them solutions, provide examples from across the country of what can be done. And I'm just going to give you a couple. Sorry, I keep doing that. I'm going to give you a couple because I think it's useful. And again, the Alliance is collecting these in a really great place on their website. The Ounce of Prevention is collecting these through a variety of resources and is going to put out a policy document in the next couple of days. The Center for Law and Social Policy CLASP is doing the same thing. So we really need to be supporting some of these ideas and remind folks that the CCPG rules are as flexible as possible. And obviously Shannon can talk about that since she ran the program. But just as an example, New Mexico has put a number of provisions in place to support childcare programs that are operating during the crisis. They're expediting background checks. They have a process in place for programs to both request food and cleaning supplies, and they've also mobilized truckers from around the state to pick them up and deliver them, which is creating lots of jobs for people. They have daily office hours for providers to call in and ask questions and get information. They've also put processes in place to allow family, friend, and neighbor care to provide emergency care and to pay those FFN providers. We've seen across the country that a lot of essential personnel are less than eager to put their kids in big group care for obvious reasons. And so allowing FFN care to be paid is a boon for those families. In Vermont, they are paying an additional $125 supplemental payment per child per week during the emergency child care period. We think this is a critical piece of helping providers stay in business and serve kids of those essential employees. In some communities, it's being called hazard pay, it's being called incentive pay, it's being called stay open pay, but it's really important to recognize that providers can't keep going on what they were being paid before, and that we really need to augment those payments for them. The thing to know about all of this is that time is of the essence in every single sense. Providers are closing and not coming back. The loan programs are opening up and will be oversubscribed in a really short period of time. And every component of the law, whether it's the paid leave, the payroll tax deferral, the retention credit, the unemployment insurance, all have timelines and deadlines and particular periods in which they apply, making that information piece as important as possible. So when we think about significant roles for state and local philanthropy, I think there's a lot of things that we could be thinking about. So obviously some of you have participated in grant programs at the community level or at the state level, as in Minnesota, helping to identify and source materials at the community level, as I talked about in New Mexico, helping to become experts in all those different programs. But there's some other things too. So one thing we're starting to hear about is that while states have figured out how to give payments to providers, to centers, to family child care, they're having trouble thinking about how to give payment directly to the individuals that are working in classrooms. And while they can write rules that say, if we gave you an increased amount of money, you need to pass that on, there is some conversation about how to give payment directly to individuals. So if philanthropy can create funds that will go directly to those that are still working and give them some offset to increase their pay, that might be helpful. As I said, information, creating connectors and providing technical assistance to navigate all those different programs. We're also seeing the need for partnerships that are sort of, that go to exactly how you all do your work. Really bringing different people together very quickly to create, to meet the kinds of needs we're seeing, whether those are the grant programs or funding pools where providers that have no limits on them, that providers and teachers and others can dip into to get what they need, whether it's a shared services model to help folks access different kinds of data, to understand bookkeeping needs, to do those loan applications, or whether it's bulk buying and those kind of things. Then there's some bigger picture things that might be useful. Really creating space to help states think about how they're planning to spend their CCPG funds. A lot of states are getting really huge amounts of money, relatively speaking. Again, the $3.5 billion is not nearly enough, but as a one-time, as this first tranche of money, they're getting a lot of money that they need to plan to spend in a meaningful way, and they may need help with that. There's also the need to gather information on the impact, and Sarah referenced this a little bit. What's happening, what's going on, and sharing stories both of closures, of families that can't find care, of providers that are struggling to stay open, and of the need for essential personnel to find childcare, whether they're finding the kind that meets their needs, whether it's in the communities where they need it, and sharing that information with legislators, stakeholders, other philanthropy, and other folks as needed. And then finally, I think there's a big role to be played in long-term strategic planning. And again, Sarah referenced this a little bit. What is going to happen with our children and families at the end of this? What is the role of schools in helping to rebuild childcare to serve children birth to 8 who have missed tremendous amounts of learning time and are suffering from trauma and other impacts of this time? What should the childcare industry really look like down the line? Is it going to be dominated by franchisees because there's so many providers that have closed? And what does that mean for serving underserved communities that are dependent on subsidies? And we know subsidies don't cover the cost of care. What kinds of grant programs will be needed to ensure that programs can open or reopen in those communities? What incentives will need to be put in place to ensure that qualified providers, classroom teachers, family childcare owners and operators are available when families are ready to go back to work? And I think those are all short, medium, and long-term opportunities for funders like you all to get into this conversation and to provide what we really need to move forward both today and tomorrow to make sure providers can access all of those things that are on the table through the CARES Act, but then also to be healthy and safe and present when families need them down the line. So I'll stop there, Shannon, and see if there's questions.
Thank you. That was great. And we did have some questions. I was watching the chat. So I think you addressed Isabel's question about, you had some great examples from New Mexico about how states were using funds flexibly. But there's a couple of things that have popped up here around this idea. I heard you, and I can even feel a little tension about, like, there's all these things that people need to figure out, and we're not used to dealing with these agencies. And by the way, there's no time, right? And so a couple of ideas have popped up. So I think if Elizabeth would be willing to unmute again, she's got an idea that several people were interested in. And then I also want to invite Vermont, I believe, and their fund had talked to us last week. So they've already told us about this thing that they're doing with different professionals in Vermont. But if you want to, after Elizabeth, Hannah, if it's relevant, if that's the kind of thing that you guys are working on through your fund with the various HR and other professionals, I'd love to share that again while we're thinking about it. So Elizabeth.
I mean, yeah, so I know we're all swirling and trying to be, especially as national organizations, trying to be as helpful as we can and find ways to plug in. And I just felt like what we would be able to do to be helpful would be to actually walk through the process of applying for some of this stuff with a local childcare provider so that we actually understood what the heck, you know, before. So to pretend like we're national experts on that would be wrong. So that's what we decided to do and try to document the story. And I think that, you know, that's something that could be replicated around the country. If you've got folks who are sitting with capacity to do that kind of stuff that are your grantees, you know, is there a way to incentivize them to go and help, you know, adopt 10 childcare providers in their community and use your childcare resource and referral network to do that, and make sure somebody's hand-holding people as they go quickly, because it does seem like time is of the essence here to get this small business opportunity to mean something for childcare providers. So, oh, and
can I ask,
I would just
you
say,
and
Shannon,
Danielle, oh.
Well, I was just going to say, and then that's sort of like the immediate fast thing that I feel like we need to be figuring out. And then in a little bit more of a timely way, we're trying to identify all of the new federal funding opportunities across the sort of cradle to career spectrum. And then also digging into the flexibility contained within all of the existing federal funding streams and putting that together in a guide for communities so that they're able to make some sense of it. So it's a lot if you're sitting at the local level trying to digest everything that's going on. And we're all trying to put together resources. So anyone who's already doing that, please tell me, and we would love to work with you.
And one question for both of anybody, but I think Sarah or Elizabeth and Danielle, you might be poised to talk about this. When we're talking about grantees that could do that kind of outreach and education, we've mentioned R&Rs. I think some of them have more, I mean, they have different capacity depending on whether they've been more focused on parents or more focused on training, and they also will have the same learning curve. But I think Child Care Aware of America is working on a way to trainer and get people stood up. We also have the community development financial institutions that a lot of people fund, right, to work, who have a lot of childcare experience, like the LISC, the Local Initiative Support Coalition, and First Children's Finance out of Minnesota, that understands the rural areas probably more than some of the other CDFIs. Can you just say a word about, like, if I was a state or local funder and I was listening to this conversation, I was like, I would like to help people apply for these things and give a grant for that. Like, who are the possibilities for different grantees that could do that?
Yeah, so I think you've named a couple of them. So again, R&Rs, the CDFIs, your local United Way, who may have experience doing some of this, CAP agencies, the community action agencies in many communities that are already doing things. We know them largely through Head Start, but many of them are already supporting a lot of different social safety net programs for families and have done some of this work with them. Banks themselves, through their community development requirements, often have a person in the bank, in the financial institution, that has this as their job, and so connecting with that person, as do credit unions, which have a requirement that they do this community outreach work.
Even the regional Federal Reserve folks.
The regional federal, yep, I've been talking to them too. There's also, in many communities, there's a local economic development agency. Sometimes it's a public agency, but sometimes it's a private agency or a public-private, and those folks too might have some of those resources. Those are just a couple of ideas.
And whatever they do, I was just going to say, making sure people understand that this is loan with forgiveness potential, because the idea that when people hear loan, they're like, oh, well, that doesn't apply to me.
Right.
So making sure that people understand what the conditions of it are.
And I think at this point, I mean, all those things are, obviously I agree. I guess one of the issues though is, because of the time, because of the competition, it's almost like any path, any avenue is a good one. You should just take it. What's more important almost is making sure that it's consistent, clear, understandable information and steps and support in order to be able to do it. So it's not an either or, but simultaneously making sure that the information about what is and how to is, funneled through anybody who will share it. But the consistency and the lack of confusion is really important, I think.
Yeah, just to build on that. So the loans are opening tomorrow in some financial institutions, and we expect that people will be applying for them tomorrow. The SBA put up a sample loan application template on their website yesterday that is pretty straightforward and easy to understand. And I think, to Sarah's point, helping people know about it, saying, look at it and carry it into your financial institution in the next couple of days with your questions, but go take it, tell them you want to get in line, is really important right now.
So I'm going to ask, we have one question about facilities that I want to get to, but before I do that, Hannah from Vermont, I think you guys last week talked about some ways that your emergency fund was going to work on this. Do you want to tell us a little bit about that?
Sure, I'm happy to. And actually, as we speak, we're hosting our first webinar for early educators with accounting and legal and HR professionals who we work with as an organization, as Let's Grow Kids, to help early educators understand their options. We have stood up what we're calling our hotline, which has 3 levels of engagement. The first is an in-progress website, a landing page with links to resources already published by partners like you all to help early educators navigate the paperwork, the various options that they have, access templates. And then the second tier is this office hours program, which we'll host weekly. We had 100 early educators sign up in the first 5 hours, which is the max for our technology right now, and for Vermont is a pretty high uptake rate. So we will record these and share them out as well. But the focus is on helping folks understand the sick leave and paid family leave, unemployment insurance, and the impact on different decisions, whether they're providing emergency care or have closed and laid off staff and are considering reopening. And the second tier of that is really helping them understand the stabilization grant that Vermont passed last week, which is essentially making programs financially whole through tuition support from the state, in addition to the emergency care supplemental funding that was mentioned earlier. Next week, we're planning on digging into small business loans, and other topics kind of in the queue are navigating tax withholding. And the third tier is direct referrals, and we are using private philanthropy to fund one-on-one sessions where these consultants can really dig into more complex issues and decision-making with early educators. And we are happy to share more as these pieces come together. It's very much a work in progress, but so far has been a really useful tool for us in supporting providers.
And Hannah, my recollection was that the experts that you're working with are giving you a discounted rate, and then you are paying for that, right? So you're paying a discounted rate, they're kicking in by the discount, and early educators benefit. Is that right?
Yes, that's absolutely true. Much of the fee is being provided pro bono, and then Let's Grow Kids is covering the remaining cost, and they are giving discounted rates. We have a couple who are providing the services entirely for free. And these are all partners that we work with as an organization, so they have a good understanding of childcare in Vermont. And we also have great working relationships with them. We were just talking with some folks in Massachusetts about doing this as well. And I think there's a lot of opportunities for communities and organizations to rely on some of the existing partnerships they have to connect experts directly with these early educators.
So that's another thing funders can do, right, is use their own relationships, not just their money. Like the
exactly.
you work with, you could leverage that to say, okay, and now we want you to work with this group. Yeah, that's really interesting. I want to be sure we get to Eric's question, and we're monitoring this chat. There's a lot of interesting stuff happening in the chat, so everybody take a look, but don't get too distracted. Eric, because of time, I'm going to just pose it for you if you don't mind. So Eric has asked a question about facilities, which I'm glad he asked about, because the minute I saw all that traffic, that news about infrastructure as the focus of the next bill, that was where my brain went to. So Sarah, I think this is probably a question for you.
Yeah, sure. So yes, it's in conversation now. I mean, people have raised it. We've had some conversations, particularly with Catherine Clark's office, who's, I know, thinking about how to move it forward. What I would, given that this process is very uncertain and how it's going to unfold, I mean, is making sure that we're factoring in to that conversation around facilities and tying in some of all of what's happened, so that we're freshening it up a little bit to account for not just what we thought the facilities issues were before, but what we could tie into that now. So short answer, yes, it's part of the conversation, and I hope it will continue to be.
Thanks. All right, Lisa Klein has her hand raised. Lisa, I think this is an opportunity for you to say whatever it was that caused you to raise your hand, and also tell us about any other things y'all are doing that you want folks to know about.
Thanks, Ms. Shannon. Hi, all. No, this is quite timely, because I was really just kind of tagging on to Hannah. Hi, Hannah. We just had a chat. So this notion of how do we all kind of coordinate and help each other, because not only it's expedient for funders and it's expedient for the people trying to support the work, it's expedient for the people doing the work. So I will say that tomorrow's Alliance call, which is Fridays 3 to 4 Eastern, is on unemployment insurance. So we have National Employment Law Center, the Child Care Law Center. Hi, Sarah, putting FFYF to work. and the early learning policy group are teed up for that call. So laser focused on unemployment insurance. Next week, and Shannon and I shot you a note right before this call, and perhaps we can find a way to kind of join forces on this one. Next week's call, because we're all singing the same Kumbaya song, is on the SBA loans. So we, again, those are Fridays from 3 to 4 Eastern. We have a couple of people that we're talking with to line up speaker-wise now. Linda Smith at BPC is going to get us 1 or 2 folk that she's been working really hard with. And we have the Main Street Alliance that we've been working with. Hannah, I will circle back with you too. So that is still being cooked, but that's kind of what's coming up and seems to be in sync with part of the conversation today.
So Rena, if you'll pop up the last slide, I think that's a really good way to end, which is what can we do next? So I think that this is working out great with our alliance partners, because if you guys are going to focus on unemployment insurance and SBA loans over this week and next, we are going to, next week's call would be a sharing call, just pretty much open, pure sharing. So we'll let the Alliance do the briefing next week on SBA, and hopefully you can call into their deep dive on unemployment tomorrow. And then our deep dive will be on April 16th. And what we hope to focus on April 16th is on emergency funds, because we know there's a variety of ECE related emergency funds popping up. We know a lot of you are thinking about, should you start them? Should you contribute to them? Should you partner up with your states on them? There's a lot of action we heard last week. And FYI, we are trying to collect up at least the ones with private philanthropy. I don't think we have the capacity to capture all the solely public ones. And we're starting a Google spreadsheet that you can link to from our website that at least would tell you the ones we've found, and we just got started. And then we'll hear from some of them and be able to have some conversation about how those are working on the 16th. So it sounds like we know everybody can't dial into every call, and that you're just, because it's too much. So people will have to pick and choose based on what they're interested in and what seems most relevant to you at any given moment. But you have 2 opportunities from the Alliance over the next couple of weeks, and we'll keep doing this time, but try not to duplicate and to coordinate with them so that we're doing different things. So with that, we are at time, I believe at 4:01. I just want to really thank you. We'll go back through the chat. I think we can capture it somehow before we get off. And if there were questions that didn't get answered or requests, we'll try to get all of those gathered up. Thank you so much for your time this afternoon, and thank you for all the work that you're doing. It really isn't, it helps, right? It helps to have hope and be inspired by everybody's work in such a hard time. Have a good afternoon, and please be well.